And here is your question. Okay, so if you have read and understood, considering it surgical anatomy station, kindly tell me if you can identify what are you looking at first to begin with?
I'm looking at the thorax diagram of a hand.
Okay.
The extensor compartments, yeah, dorsum of the hand.
Dorsum of the
On
hand,
the
very
left,
good.
then on the right,
Yes.
still dorsum of the hand with showing the anatomical snuff box.
Yes, on the right side. If you want to elaborate a little bit more, then you can say that you can see the tendons, and there is this extensor retinaculum on the left image, whereas the right image shows anatomical snuff box, tendons, and vascular structures. Okay, yes. Okay, so if you can, since you have talked about the anatomical snuff box, so can you tell me what is anatomical snuff box and how is it formed? What are the boundaries of it?
Anatomical snuff box is on the medial border. Yes. Medial border is formed by the extensor pollicis longus. The lateral border, we have the extensor pollicis brevis and the abductor pollicis longus.
So what are the contents of the anatomical snuff box?
Radial artery, then the cephalic vein also passes through. Okay.
Can you please tell me what is the significance of this anatomical snuff box? Why is it important for surgeons to know about it?
The floor contains the scaphoid bone and
yes.
trapezium. The scaphoid bone, there's injury to that part, the fracture of the scaphoid bone.
Okay, and, if you can elaborate more and tell me about the scaphoid bone, from which end does it get its blood supply? And which vessel?
Blood supply.
Yes, which vessel supplies it as well?
The vessel is supplied by the dorsal and lateral branch of the radial artery. Okay. That supplies from the distal and mid part of the scaphoid bone. The proximal part of the scaphoid bone gets blood via retrograde flow. So the blood supply to that area is usually not so good.
Okay. Can you please tell me what are the type of fractures which are common when it comes to scaphoid bone?
The type of fracture that is common.
Yes. What are the type of fracture? Or what is the common? Okay. Right. What is the best way or the most common way of diagnosing scaphoid bone fracture?
Magnetic resonance imaging.
Sorry?
MRI.
Okay. What about the clinical examination? Can you, if you can elaborate and tell me, how would you manage a scaphoid fracture?
Sorry?
How would you manage the scaphoid fracture?
The patient will be given analgesics,
Okay.
and also we have to splint
Is it possible that you can miss the scaphoid fracture once a patient comes to you with the pain in the wrist?
Yes, one can actually mix it.
Okay.
One can miss it if presented within the first 2 weeks, before the 2 weeks of the fracture. One can miss an X-ray. Can even not, it will not be visible on the X-ray, and one can actually miss it. But usually after 2 weeks, it becomes more visible.
And can you identify this structure number 16 over here in the left-hand side image?
Number 16.
Yes.
As extensor retinaculum.
Can you please tell me the attachment of extensor retinaculum?
On the radial side, scaphoid bone and trapezium. On the other side, the hook of Hammett and the pisiform.
Okay, what are the structures which pass through the extensor retinaculum or below the extensor retinaculum?
The extensor digitorum and extensor indices.
How many tendons pass below the extensor retinaculum?
There are six extensor compartments.
Okay, 6 compartments containing how many tendons?
Yes, we have extensor carpi, extensor abductor pollicis longus and extensor pollicis brevis is one compartment. Then the extensor pollicis longus is another compartment. Then the extensor digitorum and the extensor indices is forms another compartment. Then we have extensor carpi radialis longus and brevis, another compartment. Then we have the extensor digiti minimi, abductor digiti minimi.
Okay, can you please tell me if you can identify, yes, these structures? What is this 12?
So that is the
it's here, it's
tendon
here,
of the extensor digitorum.
Muscle. Okay, this muscle gets its nerve supply from where?
The what?
Nerve supply. Innervation.
Nerve supply is from
yes.
is from the radial nerve, the posterior interosseous nerve.
Can you identify? Okay, can you identify number 8 over here? In the left-hand side image.
Pass.
Okay, if you can identify number 6 here.
Number 6 should be the branch of
all
radial
right.
artery.
Moving on to the right-hand side image, if you can identify number 2 over here.
Number 2.
Yes. This is 2 and this is also 2. Okay, so
look like a vessel.
We'll move on. If you can identify number 8, number 9 over here.
Number 9.
Yes, please.
That's the ulnar artery.
Okay, if you can identify
that's the muscular branch of the ulnar artery.
Okay, if you can identify 25 as well.
25. Where is 25? I can't find it.
Yes, I'll show you again. It's here. 25.
I'm not seeing it.
Yes, here. With my cursor, please.
I'm not seeing your cursor. Okay,
yes.
sorry.
Yes,
yeah, I can see
here,
it.
Here.
Okay. 25 is the
and 16.
That's radial artery.
And 16, please.
16 is the so 25 is ulnar artery. 16 is radial artery.
Okay, moving on to the right hand side image. If you can please tell me, or you can identify, what is this 19?
That's the flexor retinaculum.
Can you please tell me the attachment of this flexor retinaculum?
On the radial side, the pisiform and the trapezium.
Yes.
Then on the ulnar side, the pisiform. Sorry, on the radial side is scaphoid and trapezium. On the ulnar side is pisiform and hook of Hammett.
How many carpal bones are there?
There are 8 carpal bones.
Please tell me in any order.
The proximal row,
Yes.
scaphoid, the lunate,
Yes.
sacroiliac, and pisiform. Distal row from radial side to ulnar, we have trapezium, trapezoid, capitate, and Hammett.
Okay. Quickly, I want you to request to identify 3 or 4 structures. If you can quickly identify, where is my cursor? Right, 31 over here.
That's one is ulnar artery.
Okay, 27, please.
27 is radial artery.
Yes, 29.
That's superficial palmar arch.
Okay, superficial palmar arch. That is formed by which vessel? Please tell me.
It's formed majorly by the ulnar artery. It forms about 2/3 of it.
Ulnar artery, yes.
Then
and
radial artery
completed by? Yes, radial artery.
Completed by
good.
the branch of the radial artery.
Very good. Okay, can you tell me in the palm of the hand there is medial, there is eminence and the lateral eminence of the palm of the hand. How are these formed?
The medial eminence. The medial eminence is the hypotenor eminence.
Yes.
And it's formed by the opponents, the minimi.
Okay.
The flexor distal and abductor distal brevis.
Okay. What are the lateral
radial
eminence?
That's the tenor eminence.
Yeah.
Formed by opponents pollicis, the flexor pollicis brevis and the abductor pollicis brevis.
In the hand, what are the movements which are present?
We have the flexion. We have flexion. We have extension. We have abduction, adduction.
And
scission. I can't remember that.
okay, if someone says the movements of hands are not the same as the movements of the thumb, is the statement true or false?
Sorry, I didn't get that, ma.
Movements of the hands are not the equal or not the same as the movements of the thumb. Is the statement true or false?
I'm not equal to that's true.
Why? For thumb, there is another extra movement which is opposition, opponents.
Yes, ma'am.
That's why.
Yes,
so
opposition.
it's not true.
Yes.
Okay.
Okay.
Good.
Okay. Sorry. So you mean it is true that it is equal, the movement by the hands and that of the thumb